Okay, which cranial nerve is affected? Yeah, you just gotta know this. If you know it, you know it. If not, I guess you don't. So, 58-year-old woman comes to the clinic, difficulty swallowing, hoarse voice, persistent cough. She has a history of hypertension and diabetes. Her uvula is deviated to the left. Gag reflex is absent. Okay, rest of the exam is normal. I'm between 9 and 10. I think gag is more 9, right? And then uvular deviation. Oh God, can't remember. I know. I mean 10. I think it's like more down, kind of maybe the hypopharyngeal area. And
Okay,
then
I
this.
want you to make sure that you look at the whole picture, right? Everything from
Okay.
top to bottom. Don't miss anything. So 9 and 10 are good ones to get between, but I want you to make sure that you're not missing anything of the clinical picture here.
She has a hoarse voice, which is laryngeal, which I feel like is lower, right? Oh wait, recurrent hoarseness can be caused by recurrent laryngeal, which is a branch of Vegas, I think. I'm pretty sure it's a branch of Vegas. So I'll go with Vegas.
Okay, did you see kind of why I said that, right?
Yeah.
You're getting fixated on, like I get it, right? So I want you to, this is kind of a good teaching point here. Okay. I want you to look at, okay, out of all the sentences, what do you think is the most important sentence of the whole stem? Like just in general.
Um, I don't know, like most like I guess I was thinking like the uvular deviation because I was like, God, it's like classic for like one
Well,
of
I'm
these.
saying in general though, like I'm saying for every question, not just this particular question. Is it the first, the second, the
Oh, the
third, the
last the last question or last
last?
sentence.
Actually, the last one is not, it's important, but it's not super important. Okay. I know that sounds really weird. It's important in the fact that it helps gear you towards what you're looking for when you read this stem. But what I'm trying to get at is the first sentence is like your chief complaint,
Okay.
right? So if your first sentence of every question is your chief complaint, just like when you talk to a patient, that's going to be the highlight of really what they're there to see, right? So you should be focusing mainly on that. You know what I'm trying to say? When you talk to a patient, right? You start with their chief complaint and then you kind of ask yourself, okay, what do I want to roll out? What do I want to roll in? Right. Those are the questions that you start asking them. Right. Of course, your physical exam is important. Of course, your review system is important. Of course, right. All that stuff is important. But like when a patient comes in and say, oh, I have difficulty swallowing, hoarse voice, and persistent cough, that is like their main complaint, aka their chief complaint. The rest of it is trying to tell a story of how that fits in with the rest of their chief complaint, right? And so if you kind of glimpse through the first sentence and you're not really taking it in like a chief complaint, then you're going to miss something, right? You're hyper fixated on uvula deviated to the left, her gag is absent on the right, which, yeah, that can be either 9 or 10, right? I mean, you're like thinking to yourself, okay, is it 9 or 10? Is it 9 or 10? But then you haven't looked at every sentence, right? Especially the first one, right? Which hoarse of voice is very specific towards one thing, which is your recurrent laryngeal nerve, which comes off of your vagus, right?
Yeah.
All right. And, you got to know that for sure. So